Hello, my name is Dr. Carmen Hawker, and today I'm doing a little recording on a antenatal class that I have been doing probably for the past 7 to 8 years maybe. I have always wanted to record it for people who have maybe not been able to attend the antenatal class, they live too far away, or as it has happened before, I have been away and I haven't been able to make the antenatal class. But this is not only for people from this particular antenatal class, this is really for anyone. So if you're watching this is what I think, in my own personal opinion, things that are possibly missing from ordinary antenatal classes. So things that you don't get taught and that I think are quite commonly missed. So today I'm talking about perinatal chiropractic care. I'm talking about primitive parenting and my famous burping techniques from the fairy gas mother herself. I am also going to be speaking about things like colic, reflux, debunking a whole bunch of stuff. And I find that stuff really useful. You kind of become a parent and you get handed this baby and you're not quite sure what to do when things go wrong. So hopefully I can help with that. Okay, before we continue, I'd love to just introduce myself. That is me, blonde. I'm now brunette. I am Dr. Carmen Hawker. I am a chiropractor and founder of Hawk Chiropractic. That is my little family-based practice where I have specialized in pediatric and prenatal chiropractic. It all started many, many years ago when I did my master's dissertation on back pain and pregnancy, and it kind of unfolded from there. My qualifications just came and came, and it's been a wonderful journey. I am a mom and I have had 2 vaginal births. I've had home and unmedicated home births with midwives, and when recording this video my daughters are 3 and 6. So I'm a Webster certified chiropractor through the ICPA. I've also since done my advanced perinatal. I'm also a SOT certified chiropractor, which stands for the sacral occipital technique, where there's lots of craniopathy and working with babies' heads. So I am very, very passionate about everything women's health, pregnancy, postpartum, and obviously pediatrics and babies. And I just absolutely adore this phase of being in your pregnancy phase and this transition into parenthood and helping moms and parents with their newborns. Okay, before I kind of start with all the good stuff, I always just like to make a small little note on chiropractic and pregnancy. I think that there is a little bit of a misconception out there that there is a big misconception. I'm being a little bit playing it off a little bit. There's a misconception that you can't get treated during pregnancy and that if you don't have any pain during pregnancy, you don't need to go to a chiropractor, which just isn't true. I cannot recommend it enough. I don't think that I would have survived during my pregnancies without chiropractic. I think that it is a beautiful thing, and that if you have the opportunity to see a Webster certified chiropractor in your area, by all means, please, just even if it's just one appointment, just go and get yourself checked. It's so much more than just going for aches and pains, and it's so much more than just having low back pain or just having sciatica or just having headaches during pregnancy. We are essentially having a look at your pelvis, and I have my pelvis here. Just give me a second. Oh, it's right next to me. Okay. Webster certified chiropractors are looking at this pelvis, and we are focusing on the power, the passage, and the passenger. The power is what is the nervous system, what is the health of the nervous system going towards this pelvis, what is the electrical system, is that functioning well, and the passage is this hole where your baby is going to go through. And is your pelvis sitting in a correct position? Think of it like a twisted straw. Can we untwist that straw to make this passage easier? And then passenger. So we very commonly treat babies that are in different positions. So or male position, breech babies, transverse babies, etc. We are not touching baby at all. We are having a look at the tension in and around the pelvis and tension in and around the uterus to make room for baby. We are making baby's apartment bigger, and in doing so they tend to flip into the correct position all on their own. So reasons to go to a chiropractor, just for general wellness check. Yes, if you've got any aches and pains, tell us about it. Very important, is your baby in well position, or are they in a breech presentation? And how can we assist with that? And helping to set you up for a vaginal birth. I can honestly attribute my times during labor. So I had one 7-hour labor and another 4-hour labor. And the only thing that I could really pin it down to was the amount and the consistency of chiropractic care that I had during pregnancy. And I can see that a direct correlation with that in practice when I'm treating my pregnant women. The women who have consistent chiropractic care throughout pregnancy, they have got shorter labor times. Okay, this is just a lovely little presentation. Hopefully inside your antenatal class, you'll be talking about active birth positions. And I like to just show you these two pictures here. This is just a very cute little picture out of a textbook of what a breech a breech presentation looks like. It's important for two reasons. One, we need to get that baby head down. It's not a natural position. And the second thing is that it's the start of pediatric care or start of pediatric chiropractic, because those little hips are in the wrong position. Okay, when you are in an active birth position, can you see how there is no pressure on the sacrum when you are in a standing or an upright position? That means that you will have a less painful labor. When you labor on your back, or you are forced to labor, or maybe you choose to labor on your back, can you see how that baby's head is going to put pressure on all your little sacral nerves? That is sore. It also makes this little space over here much shorter, and you have a much higher chance of tearing during birth if you birth on your back. So look into your active birth positions. I can possibly make a video at another stage, but I really like these two little pictures of a little slice of what's going on in your pelvis. Okay, the lineup. What I'm going to speak about, skin to skin and why it is important, bringing back primitive parenting into the modern age, and I'm going to explain that, colic versus reflux, and the burping techniques, which is always the fun stuff. Okay, skin to skin. Skin to skin is important for many, many reasons, but the definition of skin to skin is a baby with only their nappy on vertically on mum or dad and covered in blankets, okay? The reason why skin to skin is so important, and it's not often taught in antenatal classes, is it's because it's so important for a baby's microbiome. You are literally developing a baby's gut, and those first 2 hours of life, they call them the first 1,000 seconds of life, are incredibly beneficial. But often, especially if you're watching this and you're from South Africa, if you are birthing in a private hospital, you will need to request for to your OBGYN and to your pediatrician if you want to have that active skin to skin time. What are the effects of skin to skin and why it's so important? It helps to regulate baby's temperature. If your baby is too hot, mum's temperature will decrease. If baby is too cold, mum's temperature will increase to regulate baby's temperature. It is proven to regulate baby's their heart rate. It also helps to fight against hypoglycemia. So when babies are born in hospitals, they are born into a very cold environment. And when babies are born, they get blasted with this last little push of glucose from the placenta. And when they get cold, they use those glucose stores. So I don't know whether you have any friends who have recently given birth, and they'll often kind of say, oh, my baby needed to have a top-up formula because their glucose was low when they tested it. It is often from being very cold. So if you can do lots of skin to skin, it helps to stop that from happening. I already spoke about the microbiome. I honestly could do a whole talk on microbiome. I love the microbiome. It helps with vagal stimulation. Vagal stimulation is the calming down of their nervous system. Babies who get direct skin to skin for the first 1,000 seconds of life, they cry less, and they are better self-regulating even after the first 2 hours. And then it causes a hormonal storm. So it stimulates prolactin. Prolactin is the hormone that signals to your brain and body to make milk. And then it also stimulates oxytocin, which is the letdown reflex, in order for breastfeeding to initiate and to start. You do not only have to do skin to skin in the first 2 hours, you can successfully do skin to skin for up to 4 months. Okay, so primitive parenting in the modern age, and why it is so important. We are independent beings, and we want to raise independent babies, and unfortunately that is just not how it goes. The reason why I always bring this up is because every single day I have someone come into my practice, a parent come into my practice saying to me, we don't want to spoil our babies. We don't want to spoil our baby. We don't want to pick them up too much if they cry. And I really, really want to make it my life mission to debunk this. You cannot spoil your baby. When your baby cries, especially under the age of 6 months, but especially under the age of 6 to 12 weeks, and you let them cry, you are suppressing honest, primitive survival signals. And they have actually done research on this, and they have proven that babies who are nurtured, loved, cuddled, have grown up to be more independent adults. And the opposite is true for babies who are let to cry. They become very dependent adults. The other thing about always kind of picking your baby up when they cry is that when babies are in an upright position and you are cuddling them, they tend to have less gas, but I'll speak about that a little bit later. Okay, how do we bring primitive parenting back into this modern age? Primitive parenting, baby wearing, get yourself a little Ergo Baby, Ubuntu Baba. There's lots of different makes. If you're unsure on what to get for hip positioning, pop me a message, pop me a comment, and I will help you. Constant access to food, so feeding on demand. It is an absolute myth that you should feed your baby only every 3 hours. I will do more videos on this, but constant access to food, especially if you're trying to develop your breast milk supply, and this is especially important for the first 6 weeks. Co-sleeping. Co-sleeping is how you define it. Co-sleeping can be safely in your bed. It can be in a camp cot or in a co-sleeper attached to your bed, or co-sleeping is also defined as just a baby being in your room. The World Health Organization says that babies should be in your room for at least a minimum of 1 year. Okay, limited time in baby containers. Limited time in baby bouncers, in car seats that clip into prams. Not good for babies. My little tip is to raise a 90s baby. Leave the car chair in the car. I'll make a little note on paraspinal muscle activity a little bit later on, but babies should not be in containers for long periods of time. Okay, colic. The word on the tip of everybody's tongue is colic, and scared that it's going to happen to them. They've heard stories from other families. Let's debunk a couple of things. So colic is something that babies do. It's not that something that babies have, and I'll explain that a little bit later. Colic happens when a baby's crying is resistant to the carer's soothing practices. Okay, that is the definition of colic. There is no 3-hour rule. Happens before 3 hours, 3 months. It happens before 3 months, around 3 hours a day. That is a definition from like 1920 Futsak. It is not an accurate definition. A colic baby is a healthy baby. 95% of colic babies have got nothing related to anything organically that is wrong with them. They actually have been proven to gain weight better than non-colic babies. But the reason why it's so important is because parents feel robbed of their bonding experience in those first few weeks of life. So, and it's awful when it truly happens, but it is rarer than you think it is. I'm not diagnosing a colic baby almost every single day. True colic is a lot less common than you think it is. So don't fret, okay? If it happens and you think or you suspect that your baby has got colic, find yourself a pediatric chiropractor, find yourself a pediatric therapist. The only proven thing to help with colic medically is probiotics. No product on the market is going to magically make a baby better. And then the non-medical thing or conservative treatment is chiropractic care and or other physical therapy. So even if it gets you get a little bit despondent maybe from like your pediatrician or your doctors or healthcare providers reaction to you picking it up, get a second opinion. It makes such a big difference. So seek out treatment, ask for help, speak to antenatal nurses, things like that. Okay, colic versus reflux. Like I said earlier, colic is something that babies do, not something that babies have. Reflux is something that babies have, but they often get mixed up with each other. So one you will think that your baby's got reflux, but they actually have colic, and a baby has colic, but they actually have reflux, and vice versa. Colic is reflux is a distinct measurable movement of milk up the food pipe or the esophagus instead of down into the intestine. Most reflux is completely normal. It is only a problem in two scenarios. One is that if there is acid with the milk and it comes up and it burns. The second one is that if the little sphincter at the top of the esophagus, at the bottom of the esophagus, at the top of the stomach, is a little bit patent or open, and they vomit out so much that they are losing calories and not picking up weight. If your baby is crying a little bit of milk comes up, you wipe their mouth or they're wearing a little bib, we call those little they posset, and they are happy spitters, and there's nothing to be worried about. But true reflux, these are things that you're going to look for. Arching of their back, pulling away from feeding, their arms are outstretched and they're on this extended position like this. They often rotate their heads to the right, and they will often have a torticollis and or a plagio, and they think it looks like they're looking over the one shoulder. They often cough and clear their throat, and they have got a high-pitched scream, and in very severe cases they will refuse food. So those are some symptoms and signs to look out for. If you think that your baby has got reflux, please get them assessed for a lip or a tongue tie. There is definitely a link. Okay, so I added this slide in a couple of years ago where I put in a little bit of a disclaimer, because these next slides are not meant to scare you. I've added this in because this is my antenatal class where I feel things are missed in prepping parents in parenthood. So, flathead syndrome. This is, I don't know where my face has gone now, but this is one of the most common things that I see in practice, brachycephaly or plagiocephaly, tomato. It happens in the first few months of baby's life because their skulls are so soft. I call them like little marshmallows. They are super malleable, and they are very susceptible to change from external pressures. So it often can happen in the womb, and because there's not enough room or they get stuck in a certain position. But one of the most common causes or places that it happens is when babies are outside and they either are spending too much time on their backs, or they have got a little tight neck and then they get a little flattening on the side of their head. So this little baby in the middle here, that is what we call a brachycephaly, where there is a flattening at the back of the head. And this is a plagiocephaly, where there has been a tight neck and they have got a preference to look only to the one side, and they've developed a little flat head on the side. This is something that you need to very actively treat. It's not going to go away. I don't care what any healthcare practitioner says to you. I've spoken to many, unfortunately, not very progressive pediatricians over the years, and who fully believe that it's just cosmetic and babies grow out of it. That is absolutely not true. It is proven via research. So seek out treatment. So depending on the measurement, you can get this treated with an accredited chiropractor like myself. If it is very severe, it does unfortunately need a helmet. Helmets should not have a taboo around it. It is like being embarrassed about getting braces. It is just like braces. It is a correctional, conservative treatment method. Okay, so what do we do? How can we prevent this from happening? First thing, seek out treatment. Your baby's not going to grow out of it. If you notice a change in your baby's head, try and get it looked at immediately. And if your healthcare practitioner is disputing it or saying that it is not there, and your gut feeling says that they are wrong, get a second opinion. Practice primitive parenting. They put babies in a carrier, co-sleep. Keep your baby in an upright position. Limit time in a car seat. A car chair is really hard at the back there. They're not meant to be there for long period of times. If your baby is exclusively bottle feeding, so they're not breastfeeding, you're going to feed on both sides so that they've got equal pressure on their heads, like you are reproducing breastfeeding essentially. And then they must be doing tummy time, even from birth up to, you can start at around 2 kind of weeks. But if your baby is awake, there's no reason as to why they should not be spending a little bit of time on their tummies. One of the most common causes of this brachycephaly in particular is because of the Back to Sleep campaign. I'm not going to go into too much detail about this, but if you look at the current sleep protocols or sleep advice that we are medically supposed to give, babies are supposed to sleep on their backs. But when they are sleeping on their backs, they need to completely look to the side like little owls. They should not look up, and they should not be looking at a 45-degree angle. That is when problems start. And if your baby is sleeping on their backs, the whole SIDS campaign was back to sleep, tummy to play. If you are choosing to do back sleep with your baby has to exclusively do tummy time during the day. So, yeah, take what you will from that. But in severe cases, we do refer out for helmeting. Okay, the fun stuff. Burping. Burping is upper gas, okay? So babies just had milk and they have got caught, think of downing a can of Coke, and they have got caught gas in their upper chest. So we are trying to move pressure from a high pressure system, air from a high pressure system, up and out the mouth. It is a complete myth that you don't have to wind a baby after if they are breastfed. You have to wind a baby after every single feed. In the first few weeks, you actually need to wind them in between as well. If babies cry a lot randomly before or fuss before a feed, there's no rule that says you can't burp them before a feed. Think of trying to eat a burger after downing a can of Coke. It would feel a lot better if you burped before you ate the whole burger. So babies who burp before a feed, if they're super fussy, tend to feed better. The 20-minute rule. So I get asked almost on a daily basis, do I need to burp after every single feed? What happens if I don't hear a burp? The answer to that question is if you don't hear a burp, it's obviously very trapped. And you need to keep baby upright for 20 minutes so that it gives a chance for the air to come out, but it also allows the milk to go down past the stomach. This also, keeping a baby upright for 20 minutes after a feed, also helps with sleep. They go from an active sleep phase into a quiet sleep phase, and they tend to sleep for much longer. So signs of a burp or a trapped wind is this. It's EH. There are 2 sounds that I want you to know by the end of this little talk, and that is one of them. Okay, these are some videos of my burping technique. Okay, so in this video, it's much better for you to see here. Babies can't burp in a C-shaped position. We need to lengthen their spines. So we need to take the little C-shaped spines and straighten them out. And that's what you can see with my hand over there. I've then got a good hold. I've got a thumb underneath one armpit and I've got my other fingers underneath the other armpit, okay? And I'm giving them a little squeeze from both sides. I'm then using my leg and vibrating my leg and jiggling my leg, because all the little gas bubbles need to come together inside the tummy. So think of gas bubbles in a can of Coke, and they come together to make a big gas bubble so it can go up and out the mouth, okay? That's how vibration helps a lot. When you get good at it takes some time to learn this technique, okay? When you start to get good at it, you can start moving your baby from side to side, and you can start doing little circles, and that'll help just get that. Think of the can of Coke and the little the hole at the top of the can. You're trying to get the gas bubble out that little hole, so moving them around a little bit assists in that. So let's watch one more video. Want to open up their chest. Open up their chest. See the difference? See the difference? This baby is very asleep. Sleeping. Okay. So one more time here. I'm straightening up little baby's back. And I'm giving a little jiggle in a circle. They don't want to be in a slouch position. They don't want to be in a slouch position. Okay, lower gas. This I call the sneaky devil. That's why I call myself also the fairy gas mother, because I'm really good at lower gas. And I'm also really good at identifying where the baby maybe doesn't have reflux and maybe doesn't have colic. They've just got a crap ton of trapped gas in their gut. It sounds completely different to the eh. It sounds like UGH, ooh, ooh. It sounds like they are straining, okay, but we'll talk about that now. Why do babies get lots of trapped gas? For many different reasons. The main one is through feeding. So they are taking in air when they feed. Not enough gas is coming out through a burp, and it travels down into the intestine. They also get gas for other reasons. So formula-fed babies will have more gas than breastfed babies, because formula is wonderful, it's there for us, but it's not as easy, especially in the first couple of weeks, to digest in breast milk is, okay? Some other reasons why babies get gas is when breastfed babies and mom has a bean curry for dinner, or you have some kind of cruciferous vegetable like cabbage or kale or spinach, or something has just not sat right with you, and baby gets a little bit gassy afterwards. It also has a lot to do with their microbiome. So C-section babies often tend to be quite gassy because they don't go down the vaginal canal, and there's obviously nothing wrong with that. It's that they don't get exposed to the vaginal bacteria, and that doesn't necessarily contribute to their microbiome positively. So doing lots of skin to skin and adding in a lovely inclusive probiotic, send me a message or comment on this if you want a recommendation. That helps to contribute positively add to their microbiome. Okay, so the other reason as to why little babies, newborns, get lots of gas is because when you feed them, they just fall asleep. And it's very, as you saw in the video before this, it's very hard to burp a very, very tired little baby, because all they're doing is eat, sleeping, pooing every single day. So, and then the other big one is that, or the thing that I at least teach on a daily basis, is that babies under the age of 3 to 4 months do not have use of their pelvic floor, okay? So think about how in this moment you are able to push a fart out or push a poo out. They don't have that proprioception in their pelvic floor. So we need to help them open up their pelvic floor, and we need to teach them to fart. The other thing is that we always want to put these little independent babies down during the day, and that's not primitive parenting. And babies, when they're in this horizontal position, that gas has got nowhere to go. Whereas when they're in an upright position and gravity is helping with that gas. Gravity helps for the gas to move down the intestinal system, and they can fart a lot easier. Okay, so what you're going to look for, you're going to look for straining. Their little faces are going to go red. They're going to grunt like little pugs. They're going to go. You laugh probably watching this video, but that is exactly what they sound like. I can hear a discomfort, that's the name for them, a discomfort baby, probably from the other side of a shopping mall. I've got an ear for it. And they often have a very hard and bloated tummy. These babies often tend to be very dysregulated, and if you do have a baby like this, I would highly suggest going to a chiro, a pediatric chiropractor, get some help with the dysgeusia, and get some help with regulating their nervous system. Think nervous system is controlling, your nervous system controls your gut, okay? If their nervous system is on fire, or very under lots of tension, it's going to impact their guts. That's a very simple way of explaining it, but that is how chiro works. So if we can calm down the nervous system, regulate them, it helps to regulate their gas and their guts. Okay, so this is my little trick for lower gas, is to, we've been using this method for probably hundreds and thousands of years, and it is a very nice way to open up baby's pelvic floor. Okay, so now I'm going to play the video. I'm just having a little look at baby's spine here.
You like jiggling around.
Here's the poop thing.
This one.
Okay. I'm going to pause in this position. You can see the baby is basically sitting in you're popping them into a position where you've got your fingers underneath their knees, and they are basically, you're putting them in a toilet position. You can add a little jiggle inside there. I'm constantly jiggling my legs when I'm treating babies. It calms babies down. They love being vibrated. Think they've been vibrated in mommy's tummy for 9 months. No wonder they love to be rocked. So when you can see babies straining, so they've got the red face, they're trying to push out a fart, you can pop them in this position, especially if they've just had a feed and you don't want to pop them down to get some gas out with some bicycles and some circles. So this is a great tip. You don't have to hold them in this position for a very long time. Can be 10 seconds, can be 15 seconds, up to maybe about a minute, and then take them out of it and move them around. But a nice outcome from this is if they have a nice little fart. Okay. Yeah. All right, that is my antenatal talk. Thanks so much for watching. I really appreciate it. I really hope that you have learned something new, and I really hope that you have left with some pearls of wisdom or some tips and tricks when your baby comes. So when you take them home from the hospital, you know how to burp them, and you know how to look for lower gas, and you know how to position them when they need to sleep, and you know that there are benefits to wearing a baby carrier. So if you have any questions, comment them, send me a message. I'm so happy to help. If you are lucky enough to live in sunny Durban, South Africa, and you are needing help, these are my details. There's my email address, that is my contact number, and I am in Durban North on St. Andrews Drive. Yeah, I'm happy to help and help you through your journey. It has been a pleasure to record this. I know it's not perfect. I think a lot and I talk a lot with my hands, but it's just who I am. And I am also super new to this recording YouTube life. So if you love this and this is something that you have really enjoyed, please share it with friends and family. If you know someone, if you're a granny watching this or a mom watching this, and you know someone who's about to give birth, you know someone who is pregnant, please click the share button and send it along. I would really, really appreciate it. And subscribe. It allows me to do things like this more often. Okay, I hope that you guys have a wonderful day, and I wish you all the best on your newborn parenting journey.